Hi, so I'm going to talk to you a little bit about dental implants and the way that they can be used to benefit patients who have a number of teeth problems. The most common problems that patients have that we use dental implants for are obviously they've already got a tooth that's missing, and it's an area where they want to improve their bite or they want to improve the way things look. So that's the first scenario. So they've already got a tooth missing or a number of teeth missing and they want to improve that. The second area is when a tooth has to be removed. So it's not missing yet, but it's unable to save the tooth and we need to remove it. So in those scenarios, we would take the tooth out and replace that tooth that is to be removed. Other scenarios where dental implants can be used are for patients who are already missing all their teeth. They may be wearing dentures and the dentures are problematic. And as a result of the problems they're having with the dentures, we can use the dental implants to, in effect, stabilize the dentures. The dentures are basically removable teeth which would fit over the implants, and they tend to provide a really good way to alleviate the problems that patients have with problematic dentures. So loose dentures, dentures that rub on the gum, dentures that fall out and they have to use glue. So anything where there is a problem with a denture, we can use dental implants under the denture, and those implants are subsequently retained by the implants. We also have a scenario where a number of patients have teeth that are unattractive, problematic in terms of gum disease, or multiple teeth are broken and there are already teeth missing, and the whole situation is not really salvageable. So in that scenario, we are able to replace a whole set of teeth in upper jaw, lower jaw, or both jaws. And what we're doing there is we're able to replace the full set of teeth using dental implants, and these teeth are not removable, so they are fixed into position. And there are a couple of ways we can do that. One way is in patients who've had years of problems. They've usually lost some gum, they've usually got receded gums and a loss of bone associated with that. So in that scenario, we are going to use the dental implants to give a fixed set of teeth. And what we are replacing are obviously the teeth, but we're also replacing the gum. So we have a bridge which is screwed into the dental implants, and the false teeth that the patient or you'd have is going to replace the gum with artificial gum and the teeth with artificial teeth. Usually this is a two-stage procedure. So stage one is where we remove the teeth. We usually fit the dental implants on the same day as taking the teeth out. And what we're then doing is allowing things to heal, and we're giving you some teeth on the same day, on that first day. So take the teeth out, put the implants in, allow our technician and myself to make a set of temporary teeth that are screwed in on that day. We then wait roughly 4 to 6 months for healing and the bone to integrate with the implants and vice versa. And then we would make a new set of teeth that are screwed in again for the long-term teeth there. So in that scenario, we have screwed in teeth with artificial gum and artificial teeth. Some patients have not really lost much gum, and we're able to replace teeth that need to be replaced, a whole set of teeth, using a system which is called, or we call it FP1. And in this scenario, what we're doing is we're giving you a fixed prosthetic one, meaning that there are no artificial gum bits on the bridge. Or the final bridge or the final set of teeth look a little bit more natural and feel a little bit more natural at the front. But this is not suitable for everybody. and we would treat patients on a case-by-case basis. So we would say to patients, look, you are in a position where you can have this FP1 bridge with minimal artificial gum, and you can have the other one as well, and it would be your decision or your choice as a patient to make a decision in which you'd like to choose. Then the scenario is we have patients that have no bone. So we obviously have to replace that bone, and there are a number of ways we can replace missing bone using bone grafting materials and bone grafting techniques. The most common area where we find that there is a lack of bone is towards the back of the mouth, because sometimes when teeth are removed, the bone starts to shrink. At the back here, we have basically air pockets that are called sinuses. And what happens is when the teeth come out, over a period of time, the bone shrinks because of the size enlarging, and obviously the natural bone shrinkage that happens when teeth are removed. So overall, we have a reduction in height of the bone available to our patients. So in that scenario, we're able to do bone grafting surgery in the sinuses to create bone height and bone width that allows a really long-term result, giving you implants on back teeth that are missing. So what we can do is we can use dental implants to replace one tooth, a section of teeth, or a whole jaw of teeth, and every patient is treated with a bespoke plan. Pre-planning, we do some x-rays, we take some scans of your teeth, take some photos and confirm what the options available are. And then when we actually start the final planning, we take CT scans to give us a three-dimensional view of the bone that's available. We then have a scan or a 3D mold of your teeth, and we're able to basically superimpose those on top of each other, giving us extreme precision for the final set of teeth that we're making for you. One thing that we really try to make an effort for with our patients is we're trying to make sure that patients are generally never left without any teeth. So we don't like you to come in, have teeth out, and then go out the door in our practice without teeth. So we will make every effort to make sure that you've got teeth before you have your final implants, number one. Second thing that we also try and do is minimize the number of visits for you. We know that coming to a dental practice means you may have to take time off work, you may have to travel, there's nerves, and we want to make the process as comfortable and as streamlined for you as possible. So using digital technology, using that to our advantage, we're getting very accurate results. We're using dental technicians to support us, using a very streamlined process that gives you, as a patient, really good results, and also minimal visits for you as well. So if you're interested in dental implants and want to know more about what we can do for you at Natural Smiles, then give us a call, send us an email, and we'll be love to see you.